Hepatitis is the new HIV. Hepatitis spread through mother-to-child transmission. Hepatitis B can also be transmitted through sexual intercourse, then through body fluids, majorly sexual body fluids, vaginal fluids, semens, and also saliva.
Hepatitis B is a viral infection that attacks the liver, and it is spread just like HIV/AIDS.
I didn't know I had hepatitis B virus until I went for antenatal. I was pregnant with my second child.
I actually have never met anyone that has hepatitis B. I think part of it is one of those, to me, it's one of those diseases that we eradicated because of the immunizations. Neither in Poland or in the United States I've heard of anyone actually having the disease.
I have shared with a person infected with hepatitis B since 2006, since my senior four.
Very proactive with immunizations, especially in a country that has high population, that has poverty, when there's classrooms that have got 40, 50, 60 children in one classroom. I believe immunization is really, really important.
Children who get immunized for hepatitis B, and it triggers autism. I don't know if you know what autism is, but it's a learning disorder that we deal with in many schools today.
Most patients living with hepatitis B will actually not show signs, and this is a huge problem. This is because hepatitis B virus can take 10 to 20 years before the signs and symptoms become obvious.
I'm a blood donor. First of all, I didn't know where I got it from, but I think the doctor suspected because I was eating a lot of raw vegetables.
Very important that people who think might be at risk get to know their hepatitis B status.
When I disclosed my status to my family and my friends, they took it differently. People's reactions were different. For example, my husband was confused. Where did I get the virus from? My sisters did not believe me. My parents believed me, but they tried to offer an explanation as to where I could have gotten it from.
If my child had hepatitis B, of course I would seek medical attention. I would go to a hospital. I would read as much as I can about hepatitis B and learn how to deal with it.
Well, I think first of all I would learn about the disease because, like I said, I don't know much about it. So I would do a lot of research and learn about the disease. Obviously go to the doctor. I would find support groups for parents with children who have hepatitis, or with individuals who live with hepatitis, and I would become part of that community. That would be probably the most reasonable thing.
Then I would educate my child in how to manage it. I would make sure that they had extra supplements, vitamin C, just to help their immune system, because their immune system is lowered through hepatitis B. And I would probably let people around them that they have contact with know that they've got hepatitis B, because I wouldn't, if they got a cut or something, I wouldn't want another child being in contact with them. So I would kind of monitor them. And I would make sure that they weren't out playing with lots of children and not having an adult supervising them.
Depends, because at the moment I think hepatitis B is expensive. I've had it over 200,000, and for an average Ugandan, I don't think many Ugandans would immunize. I know it's cheaper in Nairobi, but still very few people fly to Nairobi. And also because people are not clear about hepatitis B. Very few people know about hepatitis B in Uganda. I think in other countries they do, but in Uganda, very few people know about it. And with worries that I've told you, it triggers many reactions. At least I've had a friend who had her child immunized, and they're autistic. And they had a rash. They had sores around their body, and the child is still very ill. So I don't think autism. There's no evidence that hepatitis B causes autism, but it does trigger many things. So I think I wouldn't at the moment.
However, most of the parents in Uganda have a negative attitude towards immunization campaigns, and some of them have actually missed out on this important program. So it is very, very important that UNEPI, under the Ministry of Health, raises a lot of awareness on the importance of immunization for this important, protection against their newly born babies. Because if they don't do this, they will assume that the new generation is actually protected against hepatitis B, yet in the actual sense are not protected.
I would definitely take my kid to be immunized against hepatitis B because I think it's a killer disease.
Coming together as patients living with hepatitis B would give us a more visible and attention from stakeholders. So in 2011, we started the National Organization for People Living with Hepatitis B. The core activity for this organization was to give psychological support and counseling to the families and people living with hepatitis B. Through our advocacy, we have managed to actually got a lot of support from the World Hepatitis Alliance, which actually advocates for over 500 million people worldwide. While HIV was afflicting 7% of the Ugandan population, 10% of the same population were actually living with hepatitis B. So we have a scenario of co-infection in Uganda, whereby co-infected patients need to be looked at as a vulnerable group, whereby treatment, counseling, testing, and social support are priorities. Hepatitis B has a lot of economic implications on the population because most of the people living with hepatitis B are between 18 to 60, and this is a period of family responsibility and economic support to their families. So if we don't actually address the issue of hepatitis B today, we might face a very huge challenge in the future because it is very, very expensive for hepatitis B to be treated and investigated.